Hello everyone, this is Dr. Anderson from Natural Health Solutions. Are you feeling like your sex life isn't what it used to be? Maybe your desire is fading. Erections aren't as strong, or intimacy feels uncomfortable. You've blamed stress, age, even your relationship. But what if the real reason is a tiny butterfly-shaped gland in your neck? Your thyroid doesn't just control your weight or energy, it's one of the most overlooked keys to sexual vitality in both men and women. And the shocking part, millions of people struggle silently, not realizing their thyroid could be the hidden saboteur. In this video, we'll uncover the truth about how thyroid health controls your sex life, explain the science, and most importantly, show you the path to restoring both your energy and your intimacy. Your thyroid produces two critical hormones, T3 and T4. Think of them as master regulators. They set the tempo for your metabolism, your energy, your brain function, your mood, and yes, even your reproductive system. In the brain, thyroid hormones regulate serotonin and dopamine, the very neurotransmitters that drive desire, pleasure, and mood. When these are out of balance, your motivation for intimacy can plummet. But it goes deeper. In your bloodstream, they regulate a protein called sex hormone binding globulin, or SHBG. If your thyroid is overactive, high SHBG levels can bind up your active sex hormones, like testosterone and estrogen, leaving less free hormone available to fuel your libido and performance. It's like having a full tank of gas but a clogged fuel line. In the ovaries and testes, these hormones directly influence the production of estrogen, progesterone, and testosterone, the core drivers of fertility, libido, and sexual function. And of course, in the body overall, they determine your baseline energy levels. And without energy, intimacy naturally suffers. When the thyroid slows down, so does everything else. This is hypothyroidism, and it's one of the most underdiagnosed reasons for sexual dysfunction, for both men and women. The first casualty is often libido. The profound fatigue and depressive feelings that accompany hypothyroidism can completely sap your desire, making intimacy feel like a chore rather than a pleasure. It's incredibly difficult to feel connected to a partner when all your energy is gone. For men, the impact is often physical and direct. Erectile dysfunction is a common complaint, resulting from poor blood flow and altered testosterone levels. Scientifically, thyroid issues can impair your body's ability to produce nitric oxide, a key messenger molecule required for blood vessel dilation and firm erections. Beyond performance, hypothyroidism can also lead to reduced sperm count and motility, directly impacting fertility. For women, the symptoms can be just as distressing. Low estrogen levels can cause significant vaginal dryness, making sex uncomfortable or even painful. Many women also report difficulty reaching orgasm. Furthermore, hypothyroidism often leads to irregular or heavy menstrual cycles, which can disrupt the rhythm and spontaneity of intimacy. The statistics are staggering. Studies show up to 64% of men and 60% of women with untreated hypothyroidism report experiencing some form of sexual dysfunction. This is not in your head, it's biology. Now, let's look at the opposite problem, hyperthyroidism. Here, the body runs in overdrive, and you might think more energy means a better sex life, but the result is often just as damaging to intimacy. For both men and women, the constant state of anxiety and irritability that comes with an overactive thyroid can completely ruin the mood. You might be physically wired, but you're mentally frayed. This is compounded by sleep problems and a feeling of exhaustion, which paradoxically kills desire, despite the high-energy state. A key issue here is the SHBG imbalance. Excess thyroid hormones can drive up SHBG levels, binding your free sex hormones and effectively reducing desire, even when your body is running on high. For men, this hormonal imbalance can still lead to erectile dysfunction. Just as with hypothyroidism, the chaos of an overactive system disrupts the delicate nitric oxide pathways needed for healthy erections. It can also cause reduced sperm count and other fertility issues. For women, hyperthyroidism often manifests as irregular or absent periods, creating unpredictability and concern. Vaginal dryness, discomfort, and a libido that is all over the place are also common complaints. Even though energy is technically high, it's chaotic and strained, leaving the body and mind too frazzled for the vulnerability and connection that intimacy requires. Here's where lifestyle and nutrition become powerful tools. Certain nutrients are essential for both optimal thyroid function and vibrant sexual health. Creating a synergistic effect, iodine is the fundamental building block of thyroid hormones. You can find it in sources like seaweed and iodized salt. Selenium is another critical mineral that protects thyroid tissue from damage and also supports sperm quality in men. Did you know that a handful of nuts like walnuts or sunflower seeds, along with a serving of fish, can really help meet your daily selenium needs? Selenium is super important for your health, and these tasty options are packed with it. Zinc plays a dual role. helping to convert thyroid hormones into their active form while also being crucial for boosting testosterone and supporting healthy ovulation. Oysters and pumpkin seeds are excellent sources. Then there's magnesium, a true powerhouse. It is critical for calming the nervous system, managing stress, and improving sleep quality, all key factors that directly impact hormone balance and your capacity for sexual function. Vitamin D acts more like a hormone in the body, regulating both immunity and the production of sex hormones. Finally, omega-3's fatty acids, found in fatty fish, help improve blood flow and support overall hormone balance. Equally important are lifestyle factors. Managing stress through mindfulness or hobbies, getting consistent, quality sleep, and engaging in regular exercise all work to improve both thyroid balance and sexual vitality. The most important message in all of this is that treatment works. Correcting thyroid disorders often restores sexual health dramatically, sometimes in ways that feel miraculous to patients. For hypothyroidism, the standard treatment is levothyroxine, a T4 replacement hormone. By replenishing what your body is missing, it helps lift your mood, restore energy, and, in many cases, bring back your libido. For hyperthyroidism, the goal is to calm the overactive gland. This can be achieved through antithyroid drugs, radioiodine therapy, or, in some cases, surgery. Once the thyroid is calmed and hormone levels normalize, the anxiety subsides and the body's systems can return to a state of equilibrium. Many patients report that once their thyroid levels return to normal, their sexual function and desire for intimacy return too, sometimes for the first time in years. So, when should you talk to your doctor? If you're experiencing low libido, erectile dysfunction, or painful intimacy, and especially if you also feel persistently tired, depressed, anxious, or notice unexplained weight changes, don't ignore it. Ask your doctor for a full thyroid panel, which should include TSH, free T3, free T4, and, if autoimmune disease is suspected, thyroid antibodies. A word on patience is also crucial here. When you start treatment, remember that hormone restoration is a gradual process. It can take several weeks or even months for your thyroid levels to fully stabilize and for your body to adjust. Consistent monitoring with your doctor and patients are vital on this journey. And always remember, sexual dysfunction is not just psychological. It is often a physical, treatable sign of an underlying thyroid imbalance. Here's the bottom line. If your sex life feels stuck, if desire is low, if intimacy has become a struggle, it might not be aging, stress, or just in your head. It could be your thyroid. For men, untreated thyroid problems can mean erectile dysfunction, low testosterone, poor sperm health, and constant fatigue. For women, it can mean vaginal dryness, painful intimacy, irregular cycles, and a fading desire. But the good news is powerful. Once thyroid balance is restored, sexual health often rebounds, desire returns, intimacy feels natural again, and energy flows back into your life. So if this sounds familiar, don't stay silent. Ask your doctor for a full thyroid panel. Support your thyroid with the right nutrients, selenium, zinc, iodine, magnesium, vitamin D, and omega-3, and take care of your body with good sleep, stress control, and movement. Your thyroid isn't just about survival, it's about thriving. It's about reclaiming your energy, your confidence, and yes, your sex life. So don't ignore the signs. The solution could be simpler and closer than you think. Thyroid health equals sexual health. Take action today to ensure this crucial message reaches others. Like this video, leave a comment below about your journey, and subscribe to our channel.